will be dangerous for pharma companies only, not to anybody else.
Yeah.
And not so good for people who do programs by prescribing these medications. It's okay. Let's
come. We are live.
Yeah. Good evening, everyone. I think today's topic is a very interesting one. That is the role of antioxidants in male fertility. And I think one of the most abused and over-prescribed drug in male infertility is the antioxidants. But today's session is to clarify a lot of things, lot of doubts about where to use, when to use, and when not to use it. So Dr. Jai will be taking us through his experience as to the usage of antioxidant in the male infertility, because he does a lot of work in male infertility and also does a lot of micro TSAs when it is indicated, and how antioxidants may play a role in cases of male fertility. Over to you, sir.
Yeah, thank you, Shilpa madam. Actually, I will start with the screen sharing and I'll try and finish this session in around 12 to 15 minutes. So, friends, I think it is very important for all of us to understand one thing as far as male fertility, especially antioxidants are concerned. Okay, see, if you try and study what has happened in nature, okay, what has God done, okay, then you will be very amazed at antioxidants. Okay, so you have the two testes, which is the standard drawing of a male reproductive system. Obviously, there is an epididymis, and then there is a vast difference through the seminal vesicles. There is the ejaculatory duct, and for the male, then there is a prostate. Okay, so I'm just drawing it a little large, and then it all continues inside the male urethra. Okay, this is the large part of the male urethra, and then it leads out through the penis. Okay, so basically, the ejaculate which comes out of this is basically what we normally want to study, and that is the semen. Now, this semen contains sperms, which is a very small part of that. It contains fluid from the prostate. So it is the prostatic fluid. Okay, it contains fluid from the seminal vesicles, which is of course the seminal fluid, which is a component, and then it has miscellaneous parts. Okay, so remember, sperms form a very less part of this, less than 2 to 3%, less than 5%. Chalo, let's put it that way. Prostatic fluid is around 30 to 40%. Seminal fluid is another 35 to 45%. Okay, and rest everything is miscellaneous. So another 5 to 6% is miscellaneous. You know, the best antioxidant, okay, which is present is actually present in the semen. Okay, the semen has the best antioxidative properties because this is typically required because the way in which the sperm is. So if you study the sperm is this way. All right, you have the sperm head. The sperm head has a very compact DNA with very minimal cytoplasm. So because there is less cytoplasm, in fact, we have studied this, the way in which a sperm is formed, the sperm formation is such that the cytoplasm keeps on reducing, and in the sperm head, the compaction of DNA keeps on increasing. Okay, now because this compaction of DNA keeps on increasing, any error which happens here, okay, it has very less corrections. Okay, and one of the error which can happen is release of free radicals. Okay, this free radicals na one which are released. Okay, so if I just try and explain, everybody is talking about oxidative stress. Oxidative stress can occur due to a variety of things. Oxidative stress can occur due to diabetes mellitus, can happen due to hypothyroidism, hyperthyroidism, can happen due to hyperprolactinemia, can happen due to obesity, can happen due to fever, can happen due to weight loss, sudden weight loss, can happen due to any form of viral illness. This has a myriad of causes, thousands of causes. Okay, can happen due to stress, can happen due to environmental factors. You can't really name it. All these are factors which cause oxidative stress, which causes the body to release free radicals. What do these free radicals do? These free radicals, basically, they are going to go and act onto the membrane and increase the permeability. Okay, so what typically happens is it starts denaturing the membrane of any cell Okay, whenever there is denaturing of membrane of any cell in the form of oxidative stress, the body has reactive mechanism to protect it. Okay, and whenever the body has a reactive mechanism, the body is dependent on the cytoplasm. As a result of which, if you study a normal cell, it will have a small nucleus and the rest of it is cytoplasm. This cytoplasm does the corrective activities. Unfortunately, in sperms, this is not present. As a result of which, God has compensated by increasing the number of sperm production. Okay, God is producing sperm in millions and millions to compensate for this. All right, and simultaneously, once you understand this entire basis, you must understand that all your studies, whatever you are trying to quote to each other, whatever you think is working in male fertility or whatever is not working in male fertility, everybody, okay, wants to supplement male factor by giving antioxidants. Okay, because the oxidative stress is so high, you want to supplement it with antioxidants. Now, antioxidant, just remember one thing, it is anything which will go and terminate the free radicals. Okay, so it is going to go and get bound to them, as a result of which it does not affect the sperms nor does it affect the sperm membrane. So all those conditions which are which I mentioned, the external causes, okay, the external causes, remember, in majority of the situations these causes are correctable causes. So if you correct the cause, you may not require antioxidants. And majority of the studies, including Cochrane meta-analysis, which has been done, almost all the studies which you see are going to either look at idiopathic male fertility, okay, or subfertile men. So when they try to look at subfertile men, these are guys who have semen counts in the range of 7 to 15 million per ml. Okay, these are guys who have some motility. Okay, so motility could be less, but let's say the motility is 20%, 15%, it's not 0%. Okay, so they have a reduced motility. These are guys who have an abnormal morphology, provided it is reported correctly. Okay, in apart from this, okay, apart from this box, in any other condition, if you are trying to give antioxidants and saying that I get very excellent result by giving this antioxidant, that means probably you have gone wrong or your sample size is less. Okay, see, I've seen people giving antioxidants for azoospermia. Okay, it's really not going to work. I've seen people giving antioxidants for very severe oats just to maintain the patient. Patient should not leave them and go. It will not work in this situation. We've seen patients getting antioxidants where is a palpable, painful varicocele. Okay, grade 4 varicocele, right? In that situation, a varicocele surgery might benefit, but your antioxidants may or may not benefit. Please remember, antioxidants will not act in situations where there is absolute asthenozoospermia. Okay, it's not going to work. It is not going to work in cases where there is systemic. Okay, that means morphology from the testis teratozoospermia. In all these situations, your antioxidants are not going to work. Okay, so keep that in mind. Have a solid indication of giving an antioxidant rather than randomly giving antioxidant just because a patient is sitting and a patient requires some medicine. Finally, since I finished 7 minutes, I want to talk of one thing. When we try to talk of antioxidants, which antioxidant to give? Okay, see, everybody who comes to you, they are going to come to you with a beautiful set of things that my company is going to give you coenzyme Q in a dose of 100. My company has astaxanthin, other one has 8, mine has 16. My company has lycopene, my company has zinc, my company has manganese. A new guy has come who is saying my company has resveratrol, so that is the best thing ever. Okay, now if you study, these are guys who are into the market for less than 200 years. Okay, I'll tell you of somebody who has been in the market for 5,000 years. Okay, so somebody who has been in the market for 5,000 years, if you study our Ayurvedic literature, there is a person called Ashwagandha. Okay, Ashwa actually means horse. Okay, Ashwagandha is an Ayurvedic term. Okay, Ashwagandha, this and its products. Okay, so once upon a time, if you were to study our ancient medicine, in that ancient medicine, no, all these antioxidants which we think may work, may not work, no, were all actually given to all these people in the form of this amla, which has vitamin C, in the form of these, plant extracts. All these things were provided to people. All these things were provided to people. All the new things also which we keep on trying to talk to each other. Superoxide dismutase, glutathione. And if you study any systematic review, it is going to tell you only one thing. Okay, that ashwagandha, vitamin C, vitamin E, your CoQ10, some people will also add selenium inside all these things. Either a single one or a combination of all these things, the word is may benefit. Okay, so when they did this Cochrane study, I had gone through it around 2-3 years back. So, they had mentioned one very nice thing in that study. They, I think, studied around 10,000 males. Okay, there was no age criteria for it, but they found that when you give antioxidants, okay, and no antioxidants, okay, so you know what they found in that situation? They found in that situation that when you give antioxidants, out of 120 people became pregnant. And when you don't give antioxidants, then out of 100, 12 to 13 people became pregnant. Okay. Now, this practically means that for a particular male, you don't really know, okay, you don't really know how much is going to be the effect of antioxidants. Just keep that in mind as a take home point. If you ask me personally, what is the antioxidant that I like to give to people, then I have done some research on this thing, and I reserve the right to be wrong in this particular thing. But I like to give Chawanprash. Okay, this Chawanprash actually contains 32 antioxidants. The one which is commercially available as well as the one which is made at home. Okay, it contains amla, it contains ashwagandha, it contains giloy, it contains various others micronutrients. Okay, and that is something which is locally available at every place in India. It is something which works very nicely, in my opinion. Okay, if you think you have failed all the commercially available antioxidants which you have, you can probably try this. Patients really like it. Okay, because it is very, very nice, and it is something which has natural body antioxidation. Okay, please try to correct all the correctable causes. Many a times we see somebody has taken 24 months of antioxidants, sperm count is 5 million. When you evaluate the patient, you come to know that he is having hypothyroidism. Just correct the thyroidism, just correct the hypothyroidism, and you will see that the sperm parameters would improve in the next 4 to 6 months. Commonly, we see this with hyperprolactinemia. Unfortunately, having visual disturbances and all these things is not so common. That's a very late stage disease. So when somebody has a hyperprolactinemia with reduced sperm counts, the minute you give tablet cabergoline, within 4 to 6 months, these people will conceive naturally. Okay, it is a very simple thing. Try to correct the endocrinological causes. In obese people, especially in males who are very obese, people say you go and do exercise. What exercise? You ask these guys to do bodybuilding. The minute you do bodybuilding, what is going to happen is that all your raw fat which has not been burnt will get burnt, your serum estriol levels will go down, and automatically your sperm counts will increase. Okay, you don't really have to depend on antioxidants for improving the sperm counts. Okay, and finally, a word of caution: irrespective of what anyone promises, that this antioxidant is the best the world has ever seen, this is the greatest ever, Cochrane states that these things may benefit in increasing some amount of pregnancy rates, but there is no benefit in DNA fragmentation. There is no benefit in reducing the reactive oxygen concentration of that sperm. There is no such benefit. So practically speaking, no matter what combination we try, it is good to try because we typically feel like giving them something. Okay, but remember, it's not going to benefit in all the cases. In fact, I use it very, very sparingly. If you ever see my prescriptions usually don't contain allopathic micronutrients or allopathic nutraceuticals. My prescriptions, if at all they want to be a nutraceutical, they would contain some plant extract or some Ayurvedic preparation or something like that. Because ultimately, micronutrient is a micronutrient, and micronutrients would not really matter if you are using a conservative method or a non-conserved method. So just keep that in mind. One small side effect of antioxidants in male fertility is acidity. Okay, a lot of these males, they first smoke and then they take an antioxidant. Then they've forgotten, so they take two in the night. All these things are common with males. It causes acidity. It is a common feedback which people give us. All right. Second, if you have given a religious 3 to 4 month therapy and if the parameters have not improved, okay, that means this parameter will not improve in the future. Do not then try and supplement letrozole. Do not then try and supplement with HMG injections and all these things. It is not going to help. Except it, some males will have idiopathic values of low sperm counts. You must put them towards assisted reproduction before they change you and go to some other doctor. Okay, so keep that in mind. With that, I think this is a very crystal clear message on antioxidants in male fertility. I don't want to go into the details of which brand is missing what and which brand should incorporate what. Bottom line is none of them is better than the other. Okay, one may follow better marketing tactics than the other, but none of them is eventually better than the other brand. Okay, so I think Shilpa madam, I've finished my 16 minutes. You can ask me 2 or 3 questions.
Yeah, what about Adizova, which is there and which is very popular?
Very good. Adizova is actually ashwagandha.
Hmm.
Adizova is a combination of 4 antioxidants. Ashwagandha is one of the key components. Giloy is the second component. It is good, but again, the same thing, madam. It is not something which will work in everyone. It works in some people. It doesn't work in some people.
Okay, and what lifestyle change advice would you give the males when they come with this subfertility? I mean, see many in, I think in Bangalore would be in a night shift BPOs and all that stuff.
Yeah.
So how is the sleep pattern like, connected to the...
Very, very important. There is a good meditation series which is available online. Okay, which is available for free on YouTube. Okay, if you just type Anulom Vilom meditation on YouTube, it's a beautiful meditation series which is available, which can be practiced by anybody. Okay, which can be practiced by anybody at any given point in time. Okay, it's very difficult to practice it because to get into that rhythm, it takes around 1 to 2 months. But once people start practicing it, it keeps them very calm. Okay, again, it may help. See, it's not going to help when you have 2 million sperm count. Okay, it is going to help when you have 10 million. Motility is good. DNA fragmentation is 12%. And instead of doing IUI, you are saying, sir, I want to try something naturally before I do IUI. See, it can also be possible that after 3 months, if he comes back to you without doing anything, okay, his sperm counts will be fantastic after 3 months without giving anything. See, because if we extrapolate this logic, then all people who are chain smokers or all people who are drinking, they should not have children, no? So how come they have five children, right? So that type of extrapolation should not be done very strictly. You can't ask a guy, hey, listen, tomorrow onwards, no, you stop drinking. Go to a social party, be a teetotaler, drink ginger ale. He will not be comfortable. Okay, if you reduce his frequency, that is okay. You can't tell him, kal se khana pina band. How? How will he do? I think so much strictness on a poor guy is not recommended, in my opinion, because it is not proven. Yeah, you can say that it is a lifestyle change which may benefit you. It has happened to us so many times. Poor guy has stopped smoking. That was the only thing which was good in his entire day, right? He stopped smoking because we told him, don't smoke, your sperm count will go up. And his sperm count did not go up. No.
Yeah. So
then what you will do?
Yeah, tell me this thing where there is fluctuation of these 7 parameters. See, once they do it is about say 5 million, then the next time they do it is about 12 million, then the next time they do it is like 6 million. So in such cases, do you think these antioxidants will work? I mean, is it that fresh crop of sperms which will come after 50 days? Yeah.
As a doctor, we should look at the lowest sperm count. As a patient, he will always try to look at his highest sperm count. Yeah, that's the common male mentality. So you must treat them by the lowest sperm count. If the sperm count, let's say one count is 2 million, and you have 5 reports which are 25 million, so that means that 2 million is wrong.
Yeah.
You must try to then, try to look into what went wrong in that semen analysis report. Okay. Otherwise, you will see, madam, antioxidant or no antioxidant, that range will be the same. 8 million, 3 million, 6 million, 8 million, 4 million. So somebody will say my count's doubled from 3 million to 6 million. But as long as it doesn't cross the threshold of 15 million per ml, WHO recommendation is the count should be more than that. Then it is considered to be normal. It
Okay.
can be 25, it is normal, 16 is normal. Both are normal.
So when it comes to antioxidants and its improvement in the parameters, what do you think? I mean, what have you observed? Does it improve the count? Does it improve the morphology? Does it improve the motility? If at all, if it is slightly less, like not completely bad, but if it is like in minimally low, I mean, which of these parameters are benefited with the antioxidants?
I don't know, madam, because I always try to look at it is, has the wife become pregnant or not? Okay. So if the lady has become pregnant, then even if those parameters are not improved, okay, he will still say a thank you and go. Okay. Even if all the parameters have improved and the wife is not pregnant or the partner is not pregnant, then all these things don't really work.
Yeah. So, do you use CoQ 300 or 100 in your practice for male infertility? You think it doesn't really, it is quite expensive, you know? I mean, it is.
My patients can't afford it.
Okay. Yeah. And even before doing a micro TSA, in cases, would you give them pre-treatment antioxidants and then do it? Not really?
No role, madam. No role.
Okay.
It has been proven. All these things have no role. All this is proven. So there is no point debating it.
Okay. Yeah, I think that's the rest of the questions. We'll take it up in the WhatsApp groups. Thank you so much. It was wonderful. So the bottom line is, like, you know, you try for 2 to 3 months if you really want to try, and if there is no benefit in these minimal disorders of semen parameters, then just go to the next step of fertility, that is ART.
Because even if you don't try, it will improve. That is what I think.
Yeah.
See, I have seen. I have used, just to tell you about CoQ. We were just taking out our data, madam. That point in time, I'm talking of CoQ-LC. When CoQ-LC was available, it was coenzyme Q with levocarnitin. Okay, and that time it was manufactured by Sanofi. Long time back. I'm talking to you of 2017-18. Okay, that year we had used 3,000 strips of CoQ-LC. Okay, and our pregnancy rates for natural intercourse cycles and ovulation induction and IUI was the same. Okay, so we stopped it after that. We were like, okay, we don't want to use it. You know, it's not changed anything.
Okay, yeah. Thank you so much.